Okay, my name is Daina from Philippines. I am 39 years old. I was diagnosed last 2018 that my mitral valve and aortic valves are blocked and need to be replaced. So when I met the surgeon in Cleveland Clinic, they started to run the test. When Dr. Manuel Agora told me that they have to find the blood, that my blood is very rare, and this they call the JK3 negative.
The patient was transferred from another hospital for a complex cardiac surgery. We detect that the patient has some kind of difficulties in finding compatible blood. I want to say that to transfuse compatible blood normally is easy. Sometimes it's difficult, and very rarely is really a challenge. This is what we had in this case. Regardless her blood type, that was B positive, that is rare but not so unrare, she had another antibody interfering with all the units B positive and O positive. So we detect that we have a challenge. So sometimes it's not so easy. We had to find which antibody was. The second and most important challenge is where to get that units, the blood unit lacking of this specific antibody.
My sisters here in UAE they are JK3 negative, but unfortunately they are in blood group A and not B, which is not much with my blood.
We call Abu Dhabi Collection Center and Dubai Blood Center, and they only had one donor that can give blood. So at that moment, we need 5, 6, 7 units minimum to go for the complex cardiac surgery and also for post-operative. So we start the global chase, a global hunt to find these rare units.
This is the first time I heard that JK3 negative. And Dr. Manuel Agora, he shared me the same case which I have. And he gave me all the support not to lose hope. And he promised me that we will win this case, Daina. We will win this case.
So at that moment, time was passing. Patient surgery needs to be done. And we contact to Madrid Blood Center. They had 2 donors, but they were not qualified to give blood at that moment. So in total, we had no enough unit, and we decided to stop the universal, the world chase. The patient had a good hemoglobin, so we decided to implement her with some kind of therapy like intravenous iron, erythropoietin to boost her bone marrow to produce red cells and to schedule self-donations. Patient was really decided to go ahead with this surgery. We also were willing to make for her the impossible.
Now I'm enjoying my life. I can now say that I can walk. Maybe I can run soon, and I can enjoy my life with my husband and with my daughter. I can enjoy every single time. Thanks God for the second life.
Nothing can be done if you don't have blood. We can do the most complicated and challenging surgery, transplant, but behind that, there are many people that gave the blood for others. So to give blood is always worthy. You have the good sensation that you are helping anonymously others to live.